Module Overview. In healthcare, patient consent, personal autonomy, and legal capacity are sacred pillars that define the ethical and lawful execution of care. Module 2 offers an advanced and comprehensive examination of how healthcare practitioners should obtain, manage, document, and respect consent, as well as how to assess a patient's capacity to make healthcare decisions independently. These practices are both ethical imperatives and legal requirements, particularly under frameworks like the General Data Protection Regulation, GDPR, and the Mental Capacity Acts in the UK and EU countries. 1. What is consent in healthcare? Consent in healthcare is the patient's voluntary agreement to receive a specific intervention, treatment, examination, or sharing of personal information after understanding the associated risks, benefits, and alternatives. Key elements of valid consent. Informed. The patient receives adequate, relevant, and comprehensible information. Voluntary. The decision is made freely, without coercion. Capacity. The patient is mentally and legally capable of making that decision. Specific. The consent applies to a clearly defined procedure or action. 2. Types of consent. Explicit written consent, used for surgeries, procedures, and clinical trials. Verbal consent, acceptable for minor interventions when properly documented. Implied consent, assumed by patient actions, e.g., extending an arm for a blood draw. Dynamic consent, a modern digital model allowing real-time updates to patient preferences. 3. Legal and ethical foundations of consent. UK, Mental Capacity Act 2005, Human Rights Act 1998, Data Protection Act 2018. EU, GDPR 2016/679, Oviedo Convention on Human Rights and Biomedicine. Canada Healthcare Consent Acts, province-specific. PIPEDA. These laws enforce a right to refuse care, even if life-saving. The duty to assess mental capacity. Proper documentation of the consent process. Transparency in how patient data is collected and used. 4. Understanding legal capacity. A patient has legal capacity if they can understand information relevant to the decision. Retain that information long enough to weigh it. Use or weigh the information to make a decision. Communicate their decision, verbally, with sign, or any method. If any of these are lacking, care providers must follow appropriate best interest procedures and involve surrogates, guardians, or advocates. 5. Consent in special populations. Children must assess GILIC competence, UK, or follow guardianship laws. Elderly dementia, evaluate capacity regularly, involve power of attorney when needed. Mental health patients, apply safeguards under the Mental Health Act, seek legal review when required. Non-English speakers, use accredited interpreters to ensure valid consent. Disabled individuals, provide accessible information formats, Braille, audio, easy-read documents. 6. Consent and GDPR, data subject rights. Under GDPR, patient data cannot be processed unless a clear, informed, affirmative action indicates consent. Consent for data must be freely given. Specific, informed, unambiguous patients must also have the right to withdraw consent at any time, and data controllers must ensure this is communicated. 7. Emergencies and consent exceptions. In urgent life-saving scenarios where consent cannot be obtained, proceed under implied consent and best interest principles. Document all actions clearly. Involve senior clinicians and adhere to local legal protocols. 8. Consent in digital health and research. Telemedicine and AI-driven diagnostics require explicit digital consent pathways. Research use of patient data must follow GDPR Article 9, processing of special categories of data. Consent forms must separate treatment consent from data sharing and research consent.